Small businesses with fewer than 50 employees are not required to provide medical insurance, but it's a different story for large companies. Here with more on how this could affect local employers are Kamal Mullenberg with San Diegans for Healthcare Coverage and health insurance broker David White. Welcome to the program.
Thank you very much.
David, how does the state's health exchange, Covered California, serve small businesses?
Well, it's a marketplace to give them a different opportunity to be able to buy insurance. They can buy insurance through the exchange or they can buy it through a broker. You want to buy it through the exchange if you can get a tax credit. There are tax credits starting next year is up to 50% if you buy through the exchange. So that's really a benefit for small businesses. However, you also have to have a average salary level of less than $50,000 if you have 25 or less employees. So there really is a lot of advantages for small businesses, and also really health insurance is a benefit. It's an employee benefit, and competitive companies want to give that to their employees.
So are the plans offered to small businesses similar to those offered to individuals?
We think that they're going to be in the future. It's kind of difficult right now to find out if they're the same. Those of us that have been in the business for a long period of time know that they're not the same as of, let's say 2013, first part of 2013. But we think that they're going to change, and eventually they will become more and more and more similar.
And Kamal, let's bring you into this conversation. As we know, small businesses with 50 employees or under are not required to provide health insurance. He talked about some of the advantages of doing that. What's in it for them to offer health insurance?
Well, I think the biggest one is for the very small businesses under 25 employees. The tax credit can be a very significant help in terms of paying for the premiums for employees. And my sense is most businesses would like to offer coverage if they can. So having some new options available to them through the exchange with the tax credit may encourage some businesses that don't offer today to offer to their employees. And the other side is that I think it's really important that small businesses understand it's a choice. There's no penalties if they don't offer coverage, but there are incentives if they do.
So let's switch to larger employers. Those with 50 full-time employees or more are required to provide health insurance. When does that mandate kick in?
It really kicks in 2015. There's been a delay in that because there were a lot of rules regarding reporting requirements for businesses, as well as a lot of pushback on the original regulation, which defined what the penalty would be and what the mandate would be. It's not really a mandate, it's more a either play or pay. I hold out hope that they're going to improve the rules, so I don't even think it's worth talking about what they're going to be because we really don't know.
And what happens if these businesses do not comply?
For this first year, nothing. But starting in 2015, there will certainly be penalties associated with not offering adequate coverage to their employees or not offering at all. But what that looks like, we don't know.
And David, what are you hearing from businesses in San Diego in regards to this?
Well, it's very, very interesting because the ones under 50, since they don't have to do it, they're a little bit confused just because they're not sure exactly what they have to do, even though there's a lot of reporting to do. The ones over 50, again, are also confused. Because one of the things that happens is if you get a company, let's say, of less than, 150, 200 people, you don't really have a big HR department that can be on top of all these things and be aware of all the things that need to be done and have people on staff that can spend all the time learning all about it. So it's really that, let's say, small to more medium-sized company that's really in kind of like in a tough time right now because they don't know exactly what to do. They really need to talk with their accountants and their attorneys and their CPAs and other people like that, as well as their broker, to find out specifically the kinds of things they have to report.
And very quickly, how do you think the Affordable Care Act will change how businesses do business?
I don't think it's going to change all that much because I think the majority of businesses right now are going to keep their plans. They're not going to change them. It will change the businesses with a lot of 10 to 12 hour employees. In other words, $10 to $12 an hour employees. For example, like a McDonald's restaurant. Many of them are owned by one man or woman might own 5 or 6 of them. And so then they're going to have more than 50 employees and they're going to have to provide health insurance. It's can be very, very difficult for them. One of the things that I see coming around is what you call a defined benefit, where you can sit there and say, I will pay X amount of dollars for your health insurance. As a company, we'll do that to you. Then that helps them to be able to buy it on their own on the exchange.
And we need to wrap it there. David Kummel, thanks for coming on the program today.
Thank you very much.